Hello all, today we are going to talk about the decortication of the lung. Okay, it is the one of the surgical procedure. So in this we are going to remove the fibrous tissue, okay, in the lung. So it may be in the lung, or maybe in the chest wall, or maybe in the diaphragm. Okay, so the fibrous tissue enveloped in this region. So these are all removed in this surgical procedure. So this surgery enabled the lung to expand and deflate during respiration. Okay, so normal expansion, normal deflation should be gone. Okay, should be achieved by this procedure. Sometimes pleural space is filled with any fluid or any tissue. Okay, so it prevents the normal inflation or normal deflation. Okay, so like these conditions are found in the emphysema, like these condition also occur. Okay, so in that time, if it is filled with the tissue, any fibrous tissue, this surgical removal is required. Okay, for whom we are do this surgical procedure? Okay, let's discuss about the indications. Fibrothorax, it is not indicated for the hemothorax or pneumothorax. Fibrothorax, okay, and emphysema. Okay, and clearance of infection, and sometimes chemothorax, and pleural thickening, and one tumor that is a malignant mesothelioma. Okay, in this condition also the decortication is indicated. Okay, then come to the contraindication. For whom we don't do this decortication, the person who having the infection in the pleural space. Okay, so we don't do. And large airway narrowing, so the narrowing is very large, which means a very short path is there, then we can't do. And uncontrolled infections, any lung infection, or the person having any coagulopathy, we don't do. Any clotting problem. Okay, and in chest wall they have any infection, we don't do. Okay, the person having infection in lung, chest wall, or any part of the lung, any other lung, we don't do. Okay, the person having the coagulopathy, we don't do. That is a contraindications. Okay, let's talk about the aim of this decortication. So in this we are going to just restore the lung expansion and deflation. Okay, we are just restoring it. Okay, and if the fibers are there, we are remove the source of infection. We can't remove the infection. We can focus on the source of infection. Okay, and if there is a fibrothorax, after that it becomes a deformity to the that chest wall. Okay, so we are preventing this deformity by removing it. Okay, let's discuss about the decortication of the lung procedure. Okay, procedure. So for this procedure, some of the equipments are required. Okay, so first we should prepare the skin with 10% of povidone iodine. Okay, and 70% of isopropyl alcohol solution. Okay, so by this we can prepare the skin. Okay, and then we should need a gown, mask, okay, sterile gloves, okay, goggles and all. Okay, then rib spreader, then lung grasping forceps, then sutures. After removal we should put the sutures, or that suture intercostal drains, so that we can drain during surgery. Okay, and dressing. Okay, so these are all we need. Then come to the preparation. Okay, so in this we can check for the chest radiograph, CT scan. Okay, so by this we can thickening what amount of pleural thickening is there, we can identify. And what about the mediastinal structure, and what about the condition of the lung parenchyma, we can notice all this in the scan. Okay, and also we should do bronchoscopy. Okay, uh, look into the lung. Okay, and also blood checkup. Is there any infection, we can check for it. Is there any clotting, we can check for it. And adequate supply of blood, okay, to the lung should be checked. Okay, then come to the positioning. Okay, okay, the person is placed in the lateral decubitus position. Okay, which means the person is in the side lying, so the diseased side is just up. So you can notice the one person is there, so like this. Okay, so that is, the position is called a lateral decubitus position. And the pillow is placed between their legs. Okay, and leg is flexed 90 degree. So this, like, we can place the patient. Then come to the technique. Okay, so first we should do the thoracotomy. Okay, it is posterolateral thoracotomy. Then entry into the thoracic cavity is established via fifth or sixth intercostal space. Okay, then rib, we check for the rib resection. Okay, and sometimes rib resection is required, sometimes rib resection is not required. Okay, if crowding is there, we should do the rib resection. After that, division of the intercostal muscles is required. Okay, after intercostal muscles, we can find the extrapleural space. Okay, in some inflammatory processes, the mediastinum is not generally involved. Okay, so during surgery, we should take care of the mediastinal structure. Okay, we should avoid the injury to the mediastinal structures. Okay, so the thoracotomy scare is like so this is our axillary region. So here, okay, in posterior side, here. So like this, we do the cut. Okay, and also we should focus on the subclavian vessels. Okay, which are all near to the apex of the lung. Okay, and during apical dissection, we should take care of it. Okay, so to avoid the hemorrhage, and we should take care of the esophagus and vena cava. Okay, after that the removal is happen. Okay, okay, so after removal of that, we should put the sutures. Okay, if there any air leak, we should put the suture, and we should place the drain. Okay, so some surgeon will place the drain in apex and base. Two, totally two drains they may place. Okay, okay, after that operation, what we have to do the care. Okay, post operative care, adequate analgesia should be given, and antibiotic therapy, so that it avoid the infections and all. And hydration, the person should be hydrated, and nutritional support. And mechanical ventilation, if the person required, we should give it. And chest tube care must be done. Okay, so tube means in some person intercostal tube drainage, they place the tube inside the chest. Okay, like this. Okay, so this is the intercostal tube drainage. Okay, let's discuss about the complications. First, hemorrhage, there may be a chance of bleeding and all, and air leak may be happen. Okay, then lung collapse may happen, and injury to the vital structure, that is heart, kidney may happen, and infection and sepsis may happen, and severe pain may happen, and chest wall deformity or scoliosis may be happen. So these like complications may occur in the person. Okay guys, in this video we just discussed about the decortication of the lung. Okay, thanks for watching guys. Tata, bye bye.